Maddie's 8, and she's half my heart. And we started with seizures around 2.5, and then we finally had genetic testing done right around 3, and she came back with GABAAR1.
So far, the symptoms that he has presented are global developmental delays. So while he's 3, he's actually about like 1.5. And strabismus of the eyes, both eyes for him, which is crossing of the eyes. So he's already had 1 surgery to correct that. I think he's on the cusp of needing another surgery. The patching just isn't working for him. And seizures, right now he's having between 12 and 20 a day.
There was just a constant stream of breakthrough seizures. We just spent so much time in the emergency room.
The expectation that they've given us, his neurologist, is basically you may not have total seizure freedom, but if you can reduce them by 50% or more, then that's kind of the goal.
There weren't anything noticeable in the beginning for Harper. She met all milestones. She had her first seizure around 13, 14 months. She had a breakthrough seizure, and it was like the gates of hell opened up. And they didn't stop, and they kept getting worse, and they lasted longer and more intense, more frequency, and it was really scary. There was a time I didn't think she was going to make it.
My daughter Royce is 16. She has the GABAAR1 gene mutation. We did not get diagnosed till she was 8. Medical stuff and technology was different back then. So before then, it was just a lot of, we were what's called global developmental delay. There was just no name for whatever she was going through, and she just had a laundry list of medical issues. Her eyes started crossing early on, which is a common thing with kids with GABAAR1, strabismus. She had her first operation at about 8 months, and that did correct it, but she does have bad vision, so she wears glasses. Just in general, a lot of delays growing up. She had low tone. She did not start walking till about 2.5. Just in general, a lot of cognitive delays, low cognitive ability. She's nonverbal.
When he turned 2, he started having seizures. So then whole exome sequencing showed the GABA-A receptor.
I don't know how Harper does it, but with every barrier, with every seizure, and she's been through so much testing and needle sticks, she bounces right back up with the most resilience and innocence.
We cried for about a week, the whole family, when we were reading. We never heard of this genetic disorder. We were reading it, like several pages, explaining symptoms, life and all that stuff. It really was devastating for the whole family.
It's been really hard to find other families and other kiddos with the same symptoms and the rareness of it.
So when I had first got the diagnosis, it was hard to find people because it was kind of like, well, which researcher knew of someone, and were they even allowed to share that information with me?
There's power in numbers, there's power in voices.
I don't think there are any words on this planet to explain the sense of peace and just the not knowing, or just knowing that you're not alone anymore.
It really helps you to, realize that other people are going through similar things that you are.
It gives you so many different perspectives of how to look at this lifestyle.
Knowing that there's other people out there that they may not have the answers, but they know what you're going through, because very few people know what this is like until you're in it.
The community aspect of this right now is trying to find somebody else that is going through what you're going through.
Monica, Augustina, and the whole team have put so much effort into the best doctors, the best tracking, the medicines, every best possible thing we have will come from this.
We are already developing some potential therapy for CURE GABA-A for some of the subunits. Yeah. So we know a lot of knowledge on GABA receptor and GABAergic signaling. And what we have not done is really to demonstrate that phenotype, that, like disease-relevant phenotype can be reversible. But we have done something in the other related disorders, still GABAergic disorders. They have epilepsy, so the patients also similar in terms of the clinical manifestation. We have done those other work in other indications, SLC6A1, SSADH deficiency. Those are the ones that we've been working for in a few years. And for those projects, we already got to a stage where we believe is quite close to clinic.
And our goal is to characterize mutations in various subunits of GABA receptor. And specifically, my focus is in the beta-2 subunit of GABA-A receptor. Why I'm excited about my research is that we have a lot of research done already on alpha-1, so we know a little bit about it, but also beta-2 does also have a lot of mutations. There's actually over 200 mutations that have been reported in beta-2, but we don't know a lot about it.
We are developing gene therapies for a series of rare diseases that affect GABA signaling. What we're doing now is research in mice, research in cells, research with molecules, but this is for purpose of eventually making this research into treatments that we can deploy among our patient communities.
We're just so super interested in how GABA receptors come together, which there's 19 subunits in the family, and we're interested in which subunits bind to what other members of a family to make up a receptor, how they behave, and how pharmacology changes their activity.
We specialize in mRNA solid lipid nanoparticle technology. We'll be developing that technology for GABA-A. Actually, we already have. It's sitting in my fridge down in San Diego, and it's ready to go into clinic.
As more and more science is driven to analyze and understand these rare disorders, there is not only a direct benefit for the kids involved, which for us obviously it's a main issue, but also for the improvement of science and medicine as a whole. So I think we need to start thinking, and if you'd like to take it in a more philosophical manner, I think people with disability are here for a reason, and they make us better in many ways. I know for sure that my daughter has made me a better person in many, many ways. And I think that's not only on a moral or personal level, but also I think medically, rare disease has a lot to contribute to the health of the healthy.
You can donate on our website at curegaba-a.org/donate.
Anybody who's able to help, it would help us.
We need a lot of money to just help all those children, and it can be your child, so you have to help them and to raise money. That's the only solution.
Please help us to raise some funds to make it happen and to fight this disease all over the world.